Hi, I'm Darcy and I'll be working with you today.
Hi, I'm Taylor.
Please take a seat. So nice to meet you. Tell me a bit about yourself and how I might be able to help you today.
My name's Taylor. I'm 24 years old. I'm a male. I'm currently living in Bathurst and I'm studying at university and I also work full time. However, I'm currently on light duty due to my injury. My family is also from Bathurst. However, I no longer live with them. I enjoy participating in sports, particularly hockey, and I was playing right up until I got injured last year.
Okay, and you've come to see me for your ACL to your right knee, is that correct?
Yes,
Yep.
the doctor has told me that I have an ACL injury.
Okay. So it sounds like you must like keeping busy then. That's good. It's great to hear. Keep up the good work and I hope it all works out for you. I have your hip referral here. It says you're currently engaging in team care arrangement. Is that correct? If so, what other specialists are you seeing?
Yes, I'm seeing a GP, a physiotherapist, and now you as well. I was originally just seeing the GP and physio, but I didn't really like the feel of the physio clinic that I was seeing. I didn't like the exercises we were doing, so I thought I might try here.
Okay, sorry to hear about that experience, but I'm also positive that we can work through your rehab together to find what works best for you. Something I'm passionate about in my practice is taking a collaborative approach with my clients to achieve goals. If you don't mind me asking, are you seeing your GP in relation to your ACL injury or something else?
Well, yeah, sort of. My GP specialises in mental health. I'm not sure whether or not he's a psychiatrist or not, but yeah, I've been seeing him for depression treatment because I've been feeling pretty down because my leg won't seem to heal properly. And I can't participate in the sporting and social events I'm used to. It's really getting to me. I'm so down all the time. Just not being able to be as mobile as I used to be. Like, I was always keeping busy. But he said, you might not be able to help. I haven't really heard much about your profession, sorry. My understanding was you're like a physio, but you can do mental health as well.
Oh, okay. I'm sorry to hear about that. I know what it's like when you're an active person, but you can't do the things you normally used to. I remember I broke my toe and it kept me out of action for a while. It was driving me crazy. So, as exercise physiologists, we're responsible for assisting people to manage their own health by participating in healthy behaviours and adopting a generally healthy lifestyle. We're trained to assist in the rehabilitation of injuries, mainly through strengthening the supporting structures and increasing mobility of the joints and tissue to relieve some tension. In the case of your ACL, I have loads of exercises that can be used in the rehabilitation of your injury, which can hopefully get you back into gear in no time. We aren't trained in mental health, but there is lots of research to suggest that participating in a generally healthy lifestyle can drastically relieve symptoms of depression, particularly in the form of exercise. I know that probably sounds like a bit of a bummer to you at the moment, but I'm confident there are plenty of ways to get you active and focused on your rehabilitation. And I'm willing to think outside the box and find something that suits you. So I guess you could say I'll focus on improving your mental health indirectly through getting you active again, which sounds like it would be particularly beneficial if that's what's getting you down. How does that sound? Do you think this is something you might be interested in?
Yeah, okay. I think my doctor did mention that actually, but I couldn't really remember, sorry. Yes, that sounds really good, but I must admit I'm a little bit skeptical because of my experience with the physiotherapist.
That's okay. I'm sure if we work together through your rehabilitation, we can find some common ground. Now, it's not my business to talk about other healthcare professionals, but was there anything in particular you didn't like about the other form of rehabilitation?
Okay, thanks. Sounds good. Yeah, mainly just the exercises. I didn't really like them, and it didn't really seem like it was working for me. But when I told them I didn't like them, they just told me to stick it out.
Okay. Well, I'm a firm believer that to achieve effective behaviour change, you have to find something that you enjoy. So we can work through the various options in different settings to see what you do and don't like and go from there.
Sounds great.
Now, before we get too specific with the exercise prescription, I must ask, it says here that your ACL happened 12 months ago, which seems like quite a while. Is that correct?
Yeah, but I did it again after going back into sport too soon just recently, which is what really got me down because I finally thought it was better and now I'm back to square one.
So how did the injury occur on separate occasions?
The first time it was an impact injury, and the second time I went back in for a tackle and went to change direction, and it just went.
Did you have surgery after the injury the first time?
No, but I'm thinking about having surgery this time. What are your thoughts?
Okay, well there's lots of evidence to support operations as effective treatment option for people who wish to return to pivoting sports such as hockey, as it's a very uncontrolled environment and there's a high risk of re-injury if the knee isn't totally stable. But it also depends on your personal situation and what you're comfortable with.
Well, I have private health insurance, so the money isn't a real major consideration. And I'm fine with surgery. I just didn't think I'd need it before I was worried that it might delay my recovery because all I wanted to do was get straight back in there. I was really looking forward to some professional advice to point me in the right direction. But that sounds like something I might go ahead with. Thanks for that.
That's okay. It looks like we've already established a starting point and something to work towards. Now, in terms of reconstructive surgery, there is research to show that the best outcomes have been shown in people who participate in a rehabilitation program prior to the operation, because this gives the knee time to stabilise and recover. This will also give you time to practice and get used to some of the exercises you'll be doing after your surgery.
Okay, that sounds good. What happens from here? Do you give me exercises to do at home, or do I have to come to the gym to do them?
Well, normally I perform a pre-screening questionnaire and basic movement assessment to see how severe your injury is and what your pain and range of motions are. First, I'd like to ask a few more general questions to gain a better understanding of any other factors that may affect the way you participate in the rehabilitation program.
Okay.
So let's start with your goal setting. You've already indicated that you'd like to return to hockey, which I think is a fantastic goal, but it's a little bit down the track. If we were to set some short-term goals, what would you have in mind?
I'm not really sure. I'm feeling really down because I can't participate in sport. I just want to feel better and be more active.
Okay, well let's look at what you do enjoy doing. Do you prefer to be indoors or outdoors?
Definitely outdoors. That was the thing with the physio sessions. They were all inside and somewhere in the gym, like in the gym setting, which I didn't enjoy.
Oh, okay, that's great. We can definitely design a program that can be completed outside. A great exercise for ACL rehabilitation is cycling, if that's something you're into.
Yeah, that sounds good actually. I didn't even think of that.
What about hydrotherapy? If you have access to a swimming pool, is that something you might enjoy?
Yeah, I enjoy swimming. My brother has a pool at his house and I visit them all the time. If there are exercises you can do in the pool, that would be great.
Okay, so it sounds like we're starting to establish some things that you might enjoy doing. I'd like to integrate goals around these. For example, a short-term goal of actively participating in swimming and cycling exercise, I'll give you 3 times a week, with the focus on working towards returning to sport as a more longer-term goal.
Yeah, okay, that sounds great. Are there any progress goals that I should be trying to achieve along the way?
Yeah, sure. Depending on how your exercises are going, we can add some progress goals in after we establish a routine. I'd like to give you some range of motion goals specifically, if that's something you'd like to work towards.
Yeah, I don't really care what the goals are, if I'm being honest with you. I'm just happy to be finally feeling that I'm working towards something.
Yeah, okay. Hopefully getting outdoors with your rehabilitation will also help to decrease your stress levels. Sometimes when our bodies are stressed, we can perceive other things as stressful. So if we can work on reducing that through getting active again, it can go a long way to improving your mental health.
Yeah, well, I'm willing to try anything that I enjoy.
Okay, great. So we've set a few short, medium and long-term goals. Finally, I'd like to encourage you to view the injury as a challenge that you're going to overcome with successful rehabilitation, rather than something that is in control of you. You can think of that as a reminder or overarching goal whilst completing the program. If you start to feel stressed out, just remind yourself that you're doing a great job and don't give up.
That's an interesting perspective. I haven't really thought of it like that before. I kind of thought about the injury controlling me instead, like you said, but that sounds like something I could do.
Okay, so it looks like we're starting to get on the right track. Before we get into the exercises, is there anything else we haven't gone over yet that might make it difficult for you to participate in a rehabilitation program?
No, not really anything else. I like the sound of it already, and I'm looking forward to doing some exercises outside and just getting active again.
Okay, great. Now, what I would like to run through is an APSS, which is a quick pre-screening tool that identifies any other risk factors you might have in relation to performing physical activity. Then I'd like to do some movement screening and take some flexibility measures, if that's okay.
Yes, that sounds great.